Hi, I'm Dr. Ed Canzati. I'm a clinical director for General Dental and a practicing dentist in Vancouver, Washington. Oral health affects not just our teeth and appearance, but can have an impact on heart disease, diabetes, cancer, infectious disease, birth complications, and much more. At General Dental, we understand the impact oral health has on overall health, and we take a complete health dentistry approach to care. You'll understand why after viewing this segment on how oral health affects your overall health.
I'd like to stand back and realize that there's some untreated inflammation here and look at the root cause. And the
10 years ago, I found a gentleman by the name of Dr. Bradley Bale who was doing family practice in Spokane, but had been kind of taking a special focus on disease, vascular disease, versus just general family practice. So we joined forces at that point. I worked with him in family practice, and then in about 2001, 2002, we decided to close the family practice and spend 100% of our efforts on vascular health. And the reason we did that is because so many people are told they are fine based on their risk factor profile, based on their age, their gender, and all of those risks, and they are harboring silent vascular disease. And the reality is, it's the vascular disease coupled with inflammation that really causes events. And that's really where the Bale-Donine method got going and started, is that we are doing something different. Rather than focusing on a risk factor paradigm, we're focused on a disease treatment paradigm.
How was your last dental checkup?
When patients come in, sometimes they're surprised when I really dig deep into their oral health, and I talk to them about what their dentist says when they come in. I ask them if they floss, and if they don't, I ask why. And it's a great conversation to have because it allows me to demonstrate that the oral cavity has systemic impact.
We've always had a keen interest in the health of the mouth in our work to prevent heart attacks and strokes, and that is just intensified as the science has evolved. We now have great science telling us that the cause of arterial disease is inflammation. And another source of arterial inflammation is infection in the mouth. With the most recent study coming out, it actually implies up to 50% or more of acute heart attacks are triggered by oral infection. That's huge. Heart attacks are the #1 killer in this country. Strokes are the #1 cause of disability. The current cost of cardiovascular disease to our healthcare system is about $518 billion. And it's all preventable. And about 4 years ago, we felt our method, which we call the Bale-Donine method, had evolved to a point where we could actually guarantee our work. So that means the patients that I personally treat, if they were to suffer a heart attack or an ischemic stroke, the fees they paid to me for my service that year I would refund. So we get extremely high-risk patients, which is fine. I like a challenging patient, and I do believe you can shut down the disease process in anybody.
Julie is a patient of mine that I met, unfortunately, after she had a heart attack. She actually had 2 heart attacks, believe it or not, at the age of 37.
I was getting ready for work one morning and probably running a little later than I wanted to. So I was getting ready, and I remember feeling rushed or being rushed, but the feeling was all in here, and then it just kept compounding. And this heaviness, I wasn't breathing deep, a heaviness was just resting on my chest, and I couldn't make it go away, and I couldn't feel better.
Julie went in with chest discomfort. They told her she had pneumonia. And she said, well, I don't even have a cough. How could I have pneumonia? And they said, well, take this antibiotic and let us know how you feel in a few days. So the next day, same thing, the chest pressure is worse. So she goes in, and this was just last year. This isn't in 1957, this is in 2012 in a metropolitan city. She goes in again, and it wasn't till her second visit that they finally determined that indeed this poor 37-year-old mother of a 3-year-old daughter is having a heart attack. So she's treated now for her vascular disease, but when she first came in to see me, the tears and the issue were not because of pain, it was because of fear. She had no idea why on earth she had a heart attack. Why would she? She's a beautiful, fit, healthy 37-year-old mother of a toddler that says she's been told she's healthy her whole entire life. Why on earth did she have a heart attack? And so with the knowledge that we have of what causes vascular disease, it was with that education and that knowledge that Julie finally understands what caused her vascular disease, and we're treating that and we're measuring the inflammation to know that our treatment is working, so she can proceed with life in confidence to know that that won't happen again. Most recently, however, I was doing Julie's inflammatory labs, and all of a sudden I saw a spike. Some inflammatory labs can be thrown off if you stub your toe, if you have a sore throat. This one really means something. It's a player in the disease state. So when this lab value is elevated, it tells me objectively that something is starting to tread on our territory of vascular stability. So that's when I pulled Julie in the office and I said, gosh, do you have anything inflammatory going on?
She said, this inflammation has got to be coming from somewhere. What is going on inside of you? She said, are you sick? Did you sprain an ankle? Anything? And I said, no, nothing. And she said, do you have a tooth that's bothering you? And I said, yes. Yes, I do.
And I said, well, let's investigate that further. Let's go back to your dentist and let me call your dentist. So that's indeed what I did, and we talked, and I said, this inflammation is being driven by something other than the common vascular risk factors that I'm treating for Julie. Can you please look a little deeper into that tooth that's been bugging her? Sent her to an endodontist who ended up doing a root canal, and it was found out that that tooth was horribly infected. Now the root canal has been treated, she's got the infection eradicated, and then doing her repeat inflammatory labs, I can now see that the inflammation is now mitigated, and onward we go. But it was really that tooth infection that really drove her vascular risk. And for someone like Julie, who had a heart attack unknowingly, we want to make sure that we just erase any chance of any vascular inflammation, including the oral systemic connection.
The total estimated cost of diagnosed diabetes in the U.S. in 2012 was $245 billion. Medical expenditures for people with diabetes are about 2.3 times higher than for people who don't have the disease, due largely to the complications of the disease, whereby a decrease in the immune system's ability to fight off infections leads to its complications. Periodontal disease is one of those infections which can adversely affect the diabetic patient.
Inflammation sets up a reaction that causes things in our body that makes us less responsive to insulin, which is how we develop type 2 diabetes. So whether it is inflammation from just a fat belly, or whether it's inflammation from gum disease, or whether it's inflammation because you've got a chronic abscess someplace, it causes the same process of a resistance to insulin, which leads to type 2 diabetes, or is the hallmark of type 2 diabetes.
Your blood sugar will not go down if you have an active periodontal infection, because when you have an infection of any kind in your body, it stimulates your liver to release sugar because your body wants to fight off that infection, and it needs that sugar to go into the cells of your body to give your cells the energy that it needs to fight off that infection. The problem is that when you get that blood sugar released into your bloodstream, it can't get to where it needs to go. We don't have the transport mechanism, the insulin, to bring it into the cells. And so the problem never goes away, okay? It can't fight off the infection. So diabetic patients understand that they'll say to me, I can't fight off infection very well. And they're exactly right. Their bodies do not fight off infection. That's why they have wounds, and that's why they have a lot of chronic conditions. The other thing is that sugar is just what bacteria feeds off of. Okay, so if you have an infection in your mouth and you have high blood sugar in your system, you're giving that infection exactly what it needs to grow. So it's a catch-22, and it's not going to go away.
We carried out a study where we asked the question, which comes first, diabetes or periodontal disease? So we took a group of individuals who did not have either disease, periodontal disease or diabetes, and we followed them for years. And this is one such case. This is a 35-year-old female with neither periodontal disease or diabetes. She was a happy young woman, and everything was just fine in her life. And then, about 3.5 years later, she developed very severe periodontal disease. And you can see the loss of bone in this area and upper teeth. So much bone is lost that the teeth have actually migrated. Some of the back teeth have so much bone loss that they're about ready to fall out. And this is what she looked like clinically at the time of the second visit. You can see the teeth have spaced. There's actually, there are abscesses, which are gum boils, which hurt. What we found is that in the time between the two visits, she also developed diabetes. And periodontal disease will actually lead to, be one of the factors in the initiation of diabetes. Now, there is another facet of the relationship between periodontal disease and diabetes, and that is if a patient has diabetes and also has periodontal disease, the periodontal disease makes diabetes worse. So it's a wonderful example of the interaction between the mouth and the body in both directions.
Hi, this is Dr. Ed Canzati again. I hope you learned something from this segment. It's clear that oral health has a direct impact on many health conditions. At Gentle Dental, we have taken this message to heart and recognize the role that our dentists and hygienists play in helping our patients maximize their overall well-being. That's why we give our clinicians additional training in comprehensive exams designed to screen for signs of underlying health conditions, including oral cancer, heart disease, and diabetes. While this is not a replacement for a medical exam, the fact that we typically see patients more often than they see their physician puts us in a unique position to help identify potential early signs of underlying problems. We at Gentle Dental embrace the complete health dentistry approach to care and hope you do too. For more information on Gentle Dental, visit www.gentleone.com or call us at 855-GENTLE7. Thank you.